everyone, thank you for coming today to this presentation where I will be introducing Dfix, a non-invasive skin closer device, or soft closing as we call it, for use for closing patient wounds after surgery. This is a Korean-made device, it's a Korean company. This is our first time exhibiting here, and over the last 3 days we have met incredible professionals from the healthcare industry who gave us amazing feedback. So if you're a healthcare professional who's looking for an innovative and unique device that provides a safe, effective and pain-free alternative to traditional skin closure methods, I hope you're at the right place. So I will start. Before we dive into the Dfix, let's look at the main benefits of non-invasive methods that, as we know, have changed post-operatory processes. As a trend moves away from invasive to non-invasive surgery choices, this creates new opportunities for the use of non-invasive surgical wound closure. So this is very good for the accident and emergency departments where there is a high patient volume, and non-invasive procedures save doctor time. So as a result, non-invasive surgical wound closures are in demand from a variety of customers. So the market expansion is anticipated, and it's also accelerated by a growing focus of minimally invasive surgical techniques, so as well as a result of the rising demand for aesthetic procedures. So additionally, as the incidence of chronic wounds like diabetic foot ulcers or venous leg ulcers and pressure ulcers rises, these devices are becoming tremendously popular since they reduce the risk of hazard or excessive scarring and infection. So compared to the traditional methods, including sutures, staples and adhesives, if we look at the comparison report, between conventional and non-invasive skin closure methods, we can see that data shows that the incidence of post-operatory superficial sternal wound infection, or SSWI, was significantly higher in the conventional group than in the non-invasive. So, however, as the non-invasive method doesn't fix all the problems, as you can see, there are still some areas of improvement to be made. So that's why at Dfix we decided to look at the reported cases and develop a device that offers considerable improvements in wound healing and medical procedures. So what is and how does Dfix work? At Dfix we have a focus on 3 different product lines, developed according to different purposes, such as wound closing and additional catheter or tube fix holding. The DIALFIX device, which is our main device, is a non-invasive soft closure device that uses a unique and innovative dial system to close the skin after surgery that can be adjusted to various body parts as its size is adjustable. So it's a 3-part system that consists of an adhesive, hydrocolloid adhesive, a soft closing strap, and a dial lock. So the hydrocolloid adhesive is applied to the skin and protects it while enabling a stable sealing and keeping the skin to a maximum adhesion. And it has a waterproof film layer, while the dial lock is used to hold the edges of the skin together, making a fine adjustment possible. The strap has a 0.223 millimeter thickness, and that helps the recovery of the patients quickly and efficiently. So here you can see a video of how it is applied. This is after subcutaneous suture in Korea. So the skin must be dry and clean, so when you apply, you just remove the back sheet by order and then just stick it on the skin at the center along the suture line. And you just press the pad overall to secure and adhere it properly. So this will also prevent the product of loosening. And then just section by section, you rotate the dial briefly. And then every time you rotate the dial, it closes the skin 0.2 millimeters. And it can stay up in the patient's skin up for 2 weeks. And then just to remove it, it's like with normal saline solution, and you just remove it as a sticker. So it's very, very simple, and it saves time and also you don't really need to have a high medical training to apply this. So in emergency departments, this can be used. Okay. And it also allows for full flexion. As you can see, yeah, the patient can move the knee freely. So, and it comes in 5 different sizes, so it allows it can be used in different surgical procedures. Okay, so as I mentioned, we have 3 product lines: DIALFIX, the one that I just showed, DIALFIX Plus, and SDFIX. DIALFIX Plus, it comes with a plate and allows for tube for the fixing of the drainage tube, and it can the plate can be disassembled, and it's like the DIALFIX, the skin closer device that I just showed. So you can see here how it's applied in the same way. You just remove the sticker and then you just apply it as a sticker basically. So then you just position the product and pass the tube through the central hole, and then just remove the back sheet and pull the strap handle to secure the tube. And you just be careful just not to get the skin jam in the strap, and confirm the tube is properly secure. And when just removing the tube, just remove the detachable handle and dispose the plate. And while turning the dial slowly, one by one, you just like close the skin, as I mentioned, and every time you turn it right, it brings the skin closer 0.2 millimeters. And then again, it can be removed 2 weeks after just by soaking it in saline. So, and SDFIX is compact and designed. Here I have another video, I think, yeah. It's designed to fix and separate the drain tube, and it has a cap that protects the wound from possible infections, so it allows the patient to shower or perform exposed activities, and also has a dial lock and a strap system. So there are several benefits of using SDFIX and Dfix for skin closure after surgery compared to other non-invasive devices. Dfix is less time consuming, it's easier to use and come in different sizes, allows again for full extension and flexion of joints, and has a catheter holding option, and doesn't require any extra equipment, and allows for a faster recovery. So Dfix can be used for a wide variety of surgeries and procedures, and it's suitable for use on both adults and children, and it can be used in both inpatient and outpatient settings as well as body parts. So you can see the comparison to other products on the market, non-invasive devices. It's again a waterproof, adjustable, soft closing, and it's very simple to use. Allows for full flexion and extension, and has a catheter holder option, and has a diverse size, and also doesn't require any extra equipment. And again, compared to other products in the market that may damage the skin, doesn't create any wound or blister, and also allows for better aesthetics. As you can see here, this is a knee replacement case, and it allows again for full flexion. And again, the hydrocolloid pad can be over 2 weeks more or less. And yeah, that's it. Thank you. If you have any questions, you can come to visit our booth.